Thanks, Carl. What a wonderful lineup you've all had, and it's lovely to see you from the front after enjoying that presentation and seeing the back of everybody's head. A special thank you to the Purple Power team and Emma for having us, and a special thank you to Paulette, who has recently visited our clinic in Cottesloe to register and get us set up to be an epilepsy safe space. So all of our staff will be undergoing training to be able to monitor, manage and create safe spaces, comfortable, know that it's a safe space for people to be that are managing epilepsy. Because exercise and epilepsy is a divisive conversation. We had where's Hayley? One of my questions for Hayley was, the heat is a really good example of, exercise increases your core temperature and your heat. So how do you make decisions about that? So there's some really interesting spaces, and as I was really disappointed to miss some of the presentations this morning. I have Dr. Gaiatzis and I share our youngest children are at school together, so I know him in a slightly different capacity as well. But his work, and there seems to be a running theme today around chronic disease state and management and the complexities and great variance in the different types of seizures and different types of epilepsy, and when and how we need to consider how to respond to those. And the reoccurring theme is personalisation, and I think that's been mentioned. I did a bit of homework on some of the presentations this morning and sitting in on the previous presentation. There is a lot of emphasis and importance in sharing the awareness around personalised prescription and personalised consideration. So just in the room, who's working in healthcare in the room? Yeah? And who's caring for somebody with epilepsy in the room? There we go. And anyone themselves that is managing epilepsy? Yep, fantastic. So what an incredible high level of information we've had access to over the next couple of days, and then to have Hayley there to be able to help decipher that information and digest that over the next few days, I think will be an important consideration. So well done, Emma, and to you and your team on presenting such a wonderful, really, really strong and varied clinical level grade information day. I'd like to, get familiar with little bits and bobs. I'd like to step back a little bit with regards to exercise, because as we've seen from the presentations this morning today, the depth and complexity of every individual case needs complete isolated consideration around whole health needs. So what I wanted to go back to is reflect and go up a level and come back to brain health and mental health, and how those two aspects interface with neurological conditions and epilepsy. Okay, we do a lot of work. There was the neuropsychiatrist that was here this morning, but also Dr. Brian Powers is a neuropsych we do a bit of work with as well. The complexity of the interfaces in these varied presentations and different facets to pathology and disease and individual personality, as somebody else touched on earlier, all need pulling apart. And sometimes I consider what we do and what we use exercise to do is pull apart this really tight knot. Has anyone ever got a necklace in a really tight knot? It's very difficult to pull that apart. You've got to just pull one part a little bit, delicately pull on the other side, and just work your way around gently. There is no easy, simple fix. It is patience, it is persistence, it is consistency and high quality information, and it's coming back to the things that we are in control of. controlling the controllables of our brain health and our mental health and how they interact together is one really powerful way in which exercise can contribute. So looking at brain health, obviously we've got our cognitive, motor and emotional function, all different aspects and considerations of our brain health. I think Hayley touched on that aspect quite well, that realisation of I need to look at my nutrition. So everything that you said in your presentation and answers was around controlling the controllables, you know, and a lot of what we do using exercise medicine is taking opportunities and looking at diagnoses as opportunities to improve long-term health, opportunities to reduce secondary and tertiary risk factors. So being able to look at what we can do in those spaces that is constructive and powerful is really important. I've got a little graph that comes later. I've only got 20 minutes with you today. What I wanted to just get a little feel for so we could use the statistics in the room to compare to the graph that we'll look at later. Who engages in exercise, regular exercise in the room? Excellent. Who found it challenging to navigate the pathway to finding what was safe for you to do? Yeah. Hayley, just out of curiosity, how did you navigate that space?
So what I kind of put my mind into it. I thought of people, friends I had, family I had, and what they did, comparing their personality with mine, and thought, need air conditioning, I don't want to sweat, I don't want to be outdoors in the sun. So started looking at things like yoga and Pilates and those sorts of things.
Great.
Yeah.
And that's and you did that independently without professional advice or support?
I did that independently. Like I say, I kind of looked in the directions of friends and family to get an idea. Up until then, weirdly, I hadn't even really had an appreciation for all the different things that everyone around me was doing. That sort of realization, as I kept on, about the opportunity for me to actually introduce something into my life that was overall going to be beneficial.
And did you find a significant change in your mental health and well-being in that? Yeah.
Without a doubt.
Yeah.
I mean, to the point it's almost a bit ridiculous that if I think I might not make a class, or, you know, I start to kind of think I need to rearrange my day or something. So yes, without a doubt, it makes a huge difference.
Fantastic. So I think in that, sitting in that space, looking at places that can improve your brain health, your mental health, and pathology-specific considerations of your condition, they're the sort of environments you want to be involved in. And I think understanding exercise physiology is who's heard of the term exercise physiologist? Getting there, slowly. Who's heard of the term physiotherapist? Right? So even in the medical profession, there is, it's muddy waters. Even between exercise physiologists and physiotherapists, it's muddy waters as to who contributes in what way and in what space. And I think just being aware and knowing that an exercise physiologist is an exercise professional for varied chronic diseases. You can get different specialists in complex chronic diseases. You can get specialists like you can in physiotherapy around different disease-specific areas, respiratory, oncology, neuro. So these are all different areas of specialisation. So being able to go on the ESA website and find an exercise physiologist in your geographical area is a really great way to start and initiate that first process that Hayley navigated independently. Sharing that level of information is really important. So really these topics I'm sharing with you today are more for note for consideration for you, almost like a little checklist of how do I know what is an efficient way, because time is valuable, you know. Being really efficient with the exercise that you have, and if you can engage in exercise that's going to improve mental health, pathology-specific health, and reduce risk, but also increase brain health, then that's the trifecta you're looking for. right? And just understanding the differences in those spaces, that day to day and week to week, you're going to need different things from each three of those spaces. You know, Hayley may wake up one day and be not feeling 100%, you know, that heat might be up a little bit. That'll impact her decision making around what exercise dose am I going to choose today that's appropriate for my current presentation and tolerance level. So how you address that and manage that independently is really important. So we go from brain health to mental health. And really this is an area that we specialise in because, and just to go back on physiotherapist, the best arrangement is when allied health workers work together. So particularly, and you'll see, I'll touch on psychiatry and nutritional psychiatry and the importance of that, and leaning into specialists like Felice Jacka, who is a specialist in nutritional psychiatry. How can we eat well, work with a dietitian, work with an exercise physiologist, seek sound advice, but then also have a wonderful physiotherapist who helps me manage my soft tissue level of tension and general well-being with pathology-specific considerations. So everyone will have very different, varied requirements in those spaces. So the varied impact, and I'm sure it was touched on earlier in the presentation prior to mine with regards to the links between different primary mental illness, if there is an underlying primary mental illness and a secondary diagnosis of epilepsy, or a secondary diagnosis of a neurological condition or a chronic disease. That is a really important consideration. Understanding that at any given time, your primary, secondary and tertiary diagnoses can swap places. And understanding that when you create a fixed space or a design or prescribe a plan, that plan is variable and it can change at any given time. And having the tools and skills to be able to monitor and manage that process rather than feeling fixed and trapped in one routine and then becoming despondent when you need to be malleable and shift into that space and not quite have the guidelines to be able to manage that. Hopefully that's what we'll be able to take away from today as well. So I mentioned Felice Jacka. She's got a few different books. She's done an enormous amount of superb work with regards to primary mental illness, but also which obviously bleeds very strongly into nutrition for brain health. Okay. And Hayley mentioned that was the first place that she lent into quite strongly in controlling those controllables was nutrition, okay? And knowing which areas to improve in and which ways to decrease stress. For example, taking enough protein immediately after you exercise to decrease the stress on the system at large and allow optimization of muscle mass hypertrophy. And reap the impact and benefits of the efforts that you've put in there. So how do you know when your primary, secondary and tertiary elements or considerations shift? And this is something that we look at and work with all the time in our space in dealing with varied, complex, chronic, mental and physical illnesses. Monitor, report, take action, manage. If you can sit in those four spaces and create opportunities for you to assess yourself and your condition and your predisposition with consideration of those variables, that's really, really key to ongoing success in management. Monitoring is a space that we use. The International Consortium of Health Outcome Measures, ICHOM, have standardised sets for epilepsy and for neurological conditions. You can take an objective PROM, patient-related outcome measure, we call them. You can have access to them on the ICHOM website and or discuss that with your GP or medical practitioner. In our clinic, we use them for pathology-specific spaces and we use them to objectively assess, inform educate and improve awareness so we can take action, monitor and manage as a patient flows through and transitions from primary, secondary and tertiary priorities in different spaces. I mean, Hayley may have, I'm being very speculative here, Hayley. Hayley may have a left degenerative OA in her knee or hip that she's also managing. So there's different considerations around her musculoskeletal interactions and routine than there are for her mental health, which her yoga is superb for, and general mobility and decreasing joint stresses and muscle tension. So understanding those different variables and how they are relevant to your individual needs collectively, whether that's a secondary cardiac risk, respiratory risk, joint, orthopedic risk, or mental illness is really important. Reporting and communicating clearly with your team care arrangement. It's very fancy. I've converted it now to touch. Being able to take action and having a team in place that you can consult with and advise is really important. I'm sure most of you are aware of that and have built good team care members around you between allied health, GPs, specialists, counsellors, carers and family members. So being objective in measures and assessment is really important in all those spaces, but also giving yourself opportunity to take action, report, so you can change your management strategies is key. So time to try. Really, it was really lovely that Hayley had mentioned yoga. We're looking here at exercise prescription and the specificities as examples of primary underlying conditions. Clinical depression, really therapeutic interventions for initial or acute chronic depressive episodes, which can also be related to neurological conditions and epilepsy. It's really important that there's a different exercise approach and prescription in that space. Yoga, functional strength work, a lot of breath work, sitting in spaces that give you opportunities to ease into your movement and carry your body with you and just be present in your body is really important in those early stages. But then as you progress, that can transition, and cardiovascular exercise plays a very key role in that space, conversely. So it's very easy to see how confusing it is as a consumer and patient and carer to be able to decipher information around exercise. And that's why I want to really bring home today, make it about you and your needs, not about what exercise you need to fit into. If you're going into an environment where you need to conform to a set class, that's not the right environment for you, for example. And the emotional and mental health pressures that come with those experiences impact the A1 most important thing, which is compliance. Compliance is critical, both in medication, as you're aware, also in dosing of exercise to maintain the body's baselines. So really the collective brain health, as you can see just for the differences in that space, and anxiety at different times, you can be feeling anxious, more anxious about how you're feeling, more anxious about certain stresses or scenarios. And a good way to get ahead of that and manage that is to create those small dosages of cardiovascular with little bursts. Right? So less is more. Precise prescription is better in any chronic disease space, but in neurological spaces in particular, where that acute fatigue and or overload is critical. Yeah. So this was a reference that I made earlier to, just interesting. I mean, you've touched on, obviously, just as long as I've been in the room, we've touched on cost and the impact of epilepsy and neurological conditions on the healthcare system at large. But you can see here too barriers to exercise graph. And a really interesting insight, no time is top of the list. Fear of seizure is very close to second. Right? So feeling safe is critical. So I'm very, very proud and pleased to be advocating for epilepsy safe spaces for exercise to occur in. That helps remove the second highest deterrent for exercise compliance. I don't like to exercise. There's usually good reasons for that. Hayley said she wasn't an exerciser beforehand. But exercise is about relationship as well. You can build a relationship and you can work on relationships. And exercise is no different to any other relationship you have. It's learning to love and trust your body and understand the pathology and how you as a collective whole person, both mentally and physically, respond to an exercise exposure or dose, all right? And being confident, proud and assertive of seeking that out rather than feeling, that one touch approach of that didn't work for me, I'm not going to try that again. It's really important to have that courage and represent until you find that space or activity that is right for you with the right support. Not sure what to do, right? So if we look at the top 4 barriers to exercise in epilepsy, creating safe spaces. No time is, just for news flashes, that number 1, that's a human objection. It's not an epilepsy objection. Every single person's biggest objection to exercise is I have no time. Right? So we all know that the counter argument to that is time is a matter of priority, right? And for you to reprioritise, you must have a return on your investment. So to be able to do that and represent and get a return on your investment, it does take a lot of courage and that first slog is not easy. So in any way, if we can make that easier, I hope that's what our profession can do. No barriers currently active. Oh, there we go. Physical limitation. You would think that, and lack of motivation or energy, they're not the issues. They're not the problems. It's finding the right fit in the right place at the right time. We can start to really increase incidental positive exercise exposure in epilepsy. Okay. Evidence of exercise therapy, and it's been touched on again today, it very much going down and looking at every individual aspect of each seizure, epilepsy and neurological condition is like going down the consummate rabbit hole. And I would encourage you to not do that and create confusion. I would encourage you to come back to yourself, your own priorities, your own personal profile, and triage yourself and your own individual needs. Because even as you can see, this is a great example of let's look at brain health versus let's look at managing seizure rates or reducing risks. So we're looking at different spaces and different reasons for even engaging in exercise. So simplify and remove the complexity by coming back to self, I think is the most important part. And never think that your individual needs are not sufficient to warrant a higher level of inquiry is really, really important across the board. So management, again, I would always encourage, and from a cost effectiveness point of view, having a physiotherapist and an exercise physiologist and a dietitian is not always viable, but approaching your GP about a chronic disease management plan and having access at least to interactions where you can present and ask measured questions of each of those professions based on your individual needs and capacities gives you 5 Medicare rebatable opportunities per calendar year to improve your relationship and compliance with exercise. Yeah. If anyone has any individual questions, we'll have some question time at the end on those spaces. So I think I've been on time. Have I stuck to the brief? Close? Well, I think I get I think seeing this beautiful ocean of purple and being exposed and having the pleasure of meeting some of the team that are involved in Epilepsy WA, Carl giving his time in this space and having some really considered and thoughtful approaches to fundraising, as well as that high quality research that you've had the privilege of absorbing today. It's an absolute privilege to be involved in Epilepsy WA, and CCA is here to support any queries that your members may have. Thank you.